I'm Karen Wilcox. I'm professor and chair of the Department of Pharmacology and Toxicology in the College of Pharmacy at the University of Utah. I also am the principal investigator of the contract site of the Epilepsy Therapy Screening Program, which is a component of our much broader program where I'm director of the Anticonvulsant Drug Development Program as well. When I was a child, my grandparents suffered from neurological disorders, and so that made me very interested in the brain. And when I went to college, I majored in psychology and physiological psychology to really understand how the brain works. I then worked for a pharmaceutical company for 6 years after college as a technician, and really learned a lot about how to do state-of-the-art electrophysiology techniques and how to study how neurons function in the brain, and wanted to continue to promote my career by going to graduate school. So I received a PhD in 1993 from the University of Pennsylvania and began my studies on epilepsy at that time. So in thinking about epilepsy, this is a neurological disorder that affects between 1% and 3% of the population. And patients with epilepsy, about a third of them don't have their seizures adequately controlled by existing drugs. And so it's a real unmet clinical need for the patient with epilepsy. And when I arrived at the University of Utah, I began to work in the Anticonvulsant Drug Development Program, or as we call it, the AD program, and began my studies looking at the preclinical efficacy and mechanism of action of novel compounds for the treatment of epilepsy. And so we're really excited and proud of the fact that many of the existing anti-seizure drugs that are available for patients today came through our program, and we really contributed to improve the quality of life with the patient with epilepsy. I think the most rewarding part of my job is working with graduate students, pharmacy students, postdoctoral fellows, and epilepsy researchers of the future, and helping them to become excited about doing the research that we do, helping push the boundaries of the kinds of research that we do, and I take great delight in seeing them succeed as investigators in their own right and contributing to the mission of helping the patient with epilepsy. In the epilepsy community, it's just really rewarding when we go out and we meet patients and advocacy groups, and we find that compounds that have been through our program really help their family members and people that they're associated with, and sometimes even themselves. And so that's really rewarding to know that we've made an impact. So when pharmacy students come to the College of Pharmacy at the University of Utah, they can also consider the PharmD PhD program. If you want to be in that program, after your first summer, you can apply for the PSURF program, which is a summer program in which they gain real-world experience doing basic research in one of our laboratories here in the college. They can also take on one of their P3 projects can happen in a basic science laboratory, and they can get more experience there. And then after their third year and in their fourth year, they can begin to take graduate level classes and actually continue to work in laboratories to get their PhD. And so when they're finished here at the College of Pharmacy, they'll have both a PharmD degree and a PhD. And this really sets up the pharmacy student very well for doing a number of different jobs. PharmD PhDs are very heavily recruited, and that's a really great pathway for them as a career choice. Sure. The advice I would give to the student interested in research is when they come in to focus on the pharmaceutical sciences pathway that's available in the College of Pharmacy program. Get involved in working in the laboratory. If one of your professors really inspires you during that first year, go talk to them, meet their students, meet their postdocs, find out what kind of research they're doing in their laboratory, and very often you can easily join a lab and get some experience. And also I would say don't limit yourself. Try a bunch of different laboratories in different fields that really are quite disparate and varied, and you might find that you really enjoy doing basic research and decide it's a good career choice for you.